Okay. Hi, I'm Mark Sklar with Reproductive Wellness, and we are here talking to Dr. Brooke Friedman from Reproductive Partners, who's going to be speaking at the Natural Family Fair this year. And Dr. Friedman, why don't you tell us a little bit about how you got into this field?
Sure. So I've always had a passion for women's health and reproductive health. And so for me, as a medical student, I really fell in love with the field of infertility. So I went through a training in obstetrics and gynecology and did 3 additional years of infertility fellowship to do exclusively infertility.
Excellent.
So, yeah.
Was that here in San Diego?
That was actually up at Stanford. So
Oh,
yeah. So I was
better.
up, yeah. So I was up at Stanford for that training, and now I love being in San Diego. So.
It's so hard to be
It is.
city.
It
Yeah.
is. I love it here, and I love Reproductive Partners. It's a great place to be.
Great. And so you're speaking at the fair about frozen embryo transfers?
Yeah. So speaking about frozen embryo transfer, and then also a little bit more broadly about how we're making IVF safer, more effective, and if I can use the term, more natural,
Yeah.
so to speak, than it has been in the past. So.
Great. And I know from working with Reproductive Partners that the practice does a lot of frozen embryo transfers.
Yes.
And have you seen a change within the practice with success rates from that kind of switch?
We have. So I think the field of infertility as a whole is trending towards doing more frozen transfers. We've been doing that for a little while now, and we're really happy with the success rates. Have been phenomenal with that practice, and we feel that it decreases some of the risks, such as hyperstimulation syndrome, that's been more common in the past with IVF, that is no longer, it's actually quite a rarity in our practice to have that now with the way that we're doing IVF. So we're using kind of more gentle stimulation, lower stimulation protocols. And with the frozen transfer, it ends up being a more natural, a more physiologic environment for the embryo. So,
that's great.
Yeah.
And will you, at the talk, also discuss, even if it's briefly, single embryo transfers?
Yeah, absolutely. And so I think one of the things that doing the frozen embryo transfers do, we often get some additional information. Often we get genetic information on the embryos before we freeze them. So then we're in a position to really transfer one embryo that we know often is genetically normal. And that allows us to have great success rates and also minimize the risk of complications like twins or higher order multiple pregnancy.
Sure. That's great. Yeah, as I've been working with the practice for many years, I've seen the practice kind of be a little bit ahead of the curve with that regard, so it's been nice, and I'm looking forward to the talk at the fair and to enlighten others about what you guys do.
Thank you. Yeah, it's really, our goal is really keeping our patients safe and just focusing an individualized treatment plan for each patient. So.
Great. Thank you. Looking forward to it.
Me as well. Thank you very much.
And hopefully all of you are as well. We look forward to seeing you there and to learning a little bit more about Reproductive Partners and what Dr. Friedman has to offer.
Yeah.
Thanks so much.
Thank you.